It is estimated that nearly 10,000 men will be diagnosed with testicular cancer this year. And while that diagnosis can be daunting, the survival rate for this particular type of cancer is high when treated early. April, Testicular Cancer Awareness Month. And we've got Dr. Peter van Vedheidsen from the University of Michigan Health West joining us this morning with some important info. Good morning, Dr. Howard.
Good morning.
Thank you for being here. We're talking Testicular Cancer Awareness Month, something obviously for the men. How prevalent is this? I mentioned 10,000. Are those numbers rising?
Yeah, they are rising for reasons we don't exactly know, but still relatively uncommon disease, less than 1% overall of all cancers, but for reasons somewhat unknown, they are rising a bit.
And this is for typically what age group? I mean, we might think of cancer and think of older thing, but this is teenagers and up, right?
Yeah, it's actually the most common cancer in men age 15 to 45.
Wow. So this cancer, testicular cancer, is the most common cancer in that age group?
In that age group, correct.
Okay. Are there different types of testicular cancer, or is it just one type to treat?
Yeah, there are different types. They're kind of based on the cells in the cancer where it arises. The two most common kind are called non-seminomatous germ cell tumor, and then pure seminomas are the two most common. They're treated a little bit differently, kind of based on the type.
And we did mention that the survival rate is good when detected early, but let's talk about that detection. Let's talk about symptoms. What would someone who may be experiencing or have testicular cancer feel?
So the most common symptom is actually just feeling a mass or abnormality in the testicle. And probably the second most common is pain or discomfort.
So just pain or discomfort or a mass, if you feel that. So I'm assuming this is along the same lines as what a doctor might say to a woman for breast cancer, where you want to be doing checkups.
Yep. So correct. Yeah. Currently, the recommendation is that men, especially in the high-risk group, do self-exams about once a month.
Okay.
Usually when you're taking a shower or something, because it's easier to do the examination. And if you notice something abnormal, talk to your doc and get it checked out.
Absolutely. Anything at all, you should definitely start with your primary care physician. And we did talk about what does treatment look like. Survival rate is in the 90 percentile, right? When it's treated early, right?
Yeah. 95% or higher if it's found early.
Wow.
Even in the advanced state, there's a fairly high cure rate, but that percentage goes down the more advanced it is.
Obviously, yeah, metastasized and gets to other parts of the body, then you've got other issues to deal with. So early detection obviously is a key thing. Where can we get more information about what we should be looking for, where to reach out? Does University of Michigan Health West have like a hub that we can go to for info?
So we do have the hub. Our network encompasses about 20 plus physicians in this area.
Okay.
It incorporates, this is kind of a multidisciplinary tumor, incorporates the surgical team. I deal with more of the chemo and diagnosis part of it, our radiation team, University of Michigan Health West and Trinity team together.
Yeah, this is a multifaceted approach to this, because you're talking with oncology, you're talking with radiology, you're talking with your primary, a lot of people involved in this.
Yes.
But the takeaway really for Testicular Cancer Awareness Month is you're already in the shower, guys. Once a month, do yourself a check, make sure that if there's any abnormalities, any type of pain, that you're contacting your primary care physician, because the survival rate for early detection is so high. Thank you very much for the time this morning, Doctor.
Thank you.
Appreciate the information. You want to learn more, there's a phone number for you. You can call that number today if you have any questions, 252-8100, or as always, uofmhealthwest.org has the answers. We'll be right back.